But throughout the month of May, we are celebrating Mental Health and Wellness Month, and we're bringing in our friends from the Guam Behavioral Wellness Center, and we've got one more friend coming in. I know we have Dr. Christiana Whitman and Sarah Harrell. Good morning, ladies. How are you?
Good morning. Thank you.
So good to have you. Okay, and now joining us in the Zoom room now, we have Norman Kitachai and also Mishan. Let me get Mishan Bamba. So half a day. Good morning, everybody.
Morning, half a day.
All right. So as we go throughout this month, and we continue to let you guys exhibit the services you provide for the company, or for the island, the community, I should say, as far as making sure that people are aware of the wealth of resources we have here for people that need mental health resources. It's also our chance as a community to be able to give back to you guys and say thank you for the tireless work that you guys do. So maybe we can start this interview by just saying, what has the last year meant for you? Dr. Whitman, we've had you on a number of times, and you've had speaking engagements, interactive Zoom forums and everything like that. But if you wouldn't mind sharing, like on a personal level, as a healthcare practitioner and as someone who's an expert in this field, what has the total sum impact of like the last year just meant for you?
Well, thanks for asking. That's actually a really, really important question, and it's something that I reflect on a lot. I actually was looking at the calendar, and a year ago, I made the career change. I was actually teaching at the University of Guam full time and made the transition to Guam Behavioral Health and Wellness Center in the middle of the pandemic. And so this last year has been very reflective for me, but it's also given me an opportunity to be very much part, or at the pulse of what was really going on, which was in a very odd way, very special to me, and very important, I guess, career-wise, personally. And so for this last year, I think it was just a really important reflection of what the community is capable of, and how much, I guess, and I'm excited because Norman and Michelle are on, and they're talking about the crisis services that are coming up, but just the continuity of services that are available locally. So that's been really where I have, and I know we're talking about mental health. So I guess for the other thing is just in terms of leveraging the mental health conversation, that's been really special to me personally also. Mm.
Now, can I just ask Christiana, because a lot of people saying, as unfamiliar as we all were as a society with what things were going on like last year, and it was very, very scary, and it was very uncertain. Making a career change probably wasn't what most HR managers would advise, like right in the middle of a pandemic and everything. But did you feel you were answering a call to service?
Part of it, yes. And I still teach at the university. I still teach part-time, and that was a very special, role for me to be in also. But yeah, I think part of it was to see kind of firsthand, or really to utilize my license as a counselor, and to be more, I guess, in the front lines. I think that was important for me at the time.
Mm-hmm. Okay, well, let's go to like Norman and Mishan now. So in terms of crisis management and everything, you guys have obviously had your hands full, like in the last year and everything like that. So how has it been for your team, and now being able to maybe kind of like reflect on what you've been able to do? And we had Jibwick representatives on the show last week, and they were saying by no means has our volume of calls to the helpline slowed down. And like, even though COVID is a very physical disease and everything like that, a lot of the mental health aspects of what we've all been dealing with continue on. So what's the tempo been like for your team?
Thank you for having us, first of all, Jason, and we appreciate you giving us this chance to share our experiences here at Jibwick. Definitely the work has definitely increased. So this pandemic has definitely reminded us of the importance of mental health. And it just as simple as our being able to professionally support our staff, and allowing them to always take self-care, right? And Mishan, would you want to chime in with the increased amount of calls with our crisis hotline?
Well, I just took the role as hotline supervisor recently, but in the last year, I did serve on the actually answering calls on the crisis hotline. And yeah, it's definitely a needed service. There were so many crisis calls related to the pandemic, and, you know, just people who have lost their jobs or who just have to cope with, you know, staying home and not being able to go out and see their family. So yeah, it's a very needed service.
Has the scope of the different types of crises that you help with and respond to, I'm sure that's, you know, broadened and everything like that. So how challenging has that been? Because I know, like, I was fortunate enough to volunteer for the holiday helpline several years ago, and they said, you know, like, you're going to get a lot of calls about people who are, you know, they're suffering from the holiday blues, or they've had too much to drink, or they're just feeling, you know, like a little bit down and everything like that. But I'm sure with the pandemic, you find folks, you know, dealt with a whole bunch of stuff you could have never anticipated. So how do you stay sharp and make sure that you can still deliver like a premium level of care and, you know, connect people with the right resources?
Well, it's really like the same technique that we try to use for almost everybody. You know, we just try to listen to their story, and then create a safety plan for them if that's something that's needed. We assess, you know, their risk level for suicide. And then if they need further follow-up, we ask them if they want to be called back.
Right.
So it's really the same, you know, we try to keep the same process, but of course, every situation is different.
Well, the fundamentals of compassion, as they say, right?
Right. Also, I wanted to also point out that we try to keep a balance between, with our crisis hotline professionals and our volunteers, so that, because, you know, it's that saying that people with lived experience only understand what people are actually going through, right? So we try to keep that balance of professional trainings, keeping them refreshed in all the different techniques and coping and trainings, as well as hiring people, volunteers that have lived experience.
Okay, now I saved Sarah for the very last because I have interviewed Sarah a number of times, and, you know, I mean, her passion for wanting to provide community service and for helping people get connected, especially when they're at their most vulnerable, I mean, is unmatched. And Sarah, it's been a couple of years since I've interviewed you and everything. So first of all, welcome back to KUM and welcome back to the show.
Thank you so much, and thank you for allowing us to, you know, share about what we've done with our partners in the community to really. I always share with our team that, like, I always like being in the background, like the real work happens in the grassroots with our community partners, with the local nonprofit organizations that we work with. So it's always a great opportunity to share and kind of brag about the successes that we've had in the past year, despite the challenges.
Mm-hmm. Now, down at the Peace Office, you guys have a very distinct mission and everything. So if you can just maybe like share what it's been like for your team in dealing with some of these crises.
Sure. So I guess I can start with really talking about what the Peace Office is. We're actually the prevention and training branch of Palm Behavioral Health and Wellness Center. PEACE is an acronym, as with many other acronyms that we work with in the government. PEACE stands for Prevention, Education, and Community Empowerment. So those are the two core functions of our branch. When we talk about mental health services, we tend to focus. I'm not going to say it's not a misconception, because it is true. Mental health services, direct services, particularly, are provided by clinicians to individuals or to families, but that's not what all mental health is all about. You know, statistically speaking, only 5% of the population are those who are thinking about suicide or are in need of a mental health diagnosis or treatment. But there's also the 95% of the population. We still have mental health. There's still challenges to our mental health that we deal with, daily. We just so happen to be kind of supported and covered by this invisible life protecting barrier, and that's kind of what prevention services are all about. Mm-hmm. It's not provided by the 7 staff that we have in our team. It's really happening. Prevention really happens in the dinner table among family members, or in the schools, by coaches throughout, like in sport events, or among youth serving organizations. So our branch really works hard to empower our community partners or our prevention champions so that they can be, sources of support. We call them natural supports. They might not have the clinical background or the training, but they can still do mental health promotion within their own means. So the past year, there's almost like a formula of how you do prevention. But in the past year, that has been challenged, as with everything else. We always say that, think us outside the box. But in the past year, we threw away that box because everything is just like uncharted waters. We're not used to not being able to physically connect with our partners and our partners being able to connect with their community members. So I commend our partners, our local nonprofit organizations who are doing prevention work for really pushing themselves and being extra creative, learning how to use Zoom and doing outreach, learning how to use social media beyond what they're already doing prior to COVID, so that they can still provide support and provide a source of be a resource for their community members, even though they can't be with them physically. I think it's just been a year of pushing boundaries, and that's one success. It's a silver lining that we're owning. Being able to still be out there and still be talking about prevention and provide resources to our community members. That was a challenging fit, and our partners have been able to do so and are still continuing to do so.
Yeah, did I tell you, ladies and gentlemen, that she's a little bit passionate about her job? I think it's abundantly clear. Okay, so guys, I'd like you all just to unmute your mics, and we can go. Feel free to jump in as you wish now, because one thing I'd like to shed light on is in this month where we make sure the Guamanians know exactly what mental health resources are available. It's also important to understand on a much more macro level exactly what mental health is these days. And we've been through some pretty revolutionary times in the past few years. Just about mental health has changed, and a lot of people said, I didn't realize that there are possibly afflictions that I may be dealing with that before would have had to be clinically diagnosed. So how do you think the I don't want to call it the business of caring for people, but let's say the vocation, the calling again for providing mental health resources for people. How has that changed over the last few years?
I can start with that. I think we've realized the need to. So as a counselor educator, something that I'm always highlighting with counselors in training is that the need to be flexible and adaptable. And I think that's shown even more so in the last year, is that need to be flexible and adaptable and to really just roll with the way things are going. And so I think that can really test your drive to be in the profession, because I'm sure, as a number of us, I'm sure everyone here on this call right now can attest that there was a point throughout the year that they probably thought, oh wow, what am I doing? Is this really where I should be, or what I'm supposed to be doing? And so we all had to kind of put on our, think of our self-care and really think about and reflect on if we're that adaptable, how resilient are we to be able to stay in that state, in this space. So I think in terms of just highlighting that, that knowing that that this field is a space that really you need to kind of pave the way to be to change, and to change as the needs arise, right? And so we've had to adapt to, and it's been difficult, especially for counselors, I think, to really adapt to telehealth services, because you really lose that kind of personal connection with the clients that you're serving. At the same time, I know, and Sarah can share this, but even telehealth trainings, it's very different. It's a different experience. And we've been trying to pivot our trainings to Zoom, and you lose a little bit of what was offered in the past. So that's my little 2 cents.
All right. Yeah.
I think for me, I feel like with mental health, it's starting to become, there's more conversation about it, which is great, but it's also becoming more apparent that it has to be integrated into just overall health. It used to be a standalone, as if you're just doing your annual physical exam. With mental health, it's just whenever you feel really, really down or depressed, or when you're thinking about suicide, that's when you think about mental health services. Not anymore, which is a great thing. And I think that's what the past year of the pandemic has taught us, that our mental health really is essential to our overall health. And if we do need to take the time to step back from our work or from our responsibilities with our families, of the roles that we put on our shoulders, we need to do that so that we can kind of refill our ability to provide care to those that we love. Self-care has become like a coined term, right? Like in the past year. And it's always been a term that we use in the field, but we're very happy that it's becoming not just like a keyword, but just a practice. It's becoming a practice for people to just, take a break and give themselves some time to recuperate.
Yeah, Dr. Whitman actually said it earlier. Is she said, she is an expert in the field of understanding the whole science behind this, but she said, she still takes the time to reflect and and to introspect and everything. A lot of people just think self-care is, okay, well, I'm going to take some of my stimulus payments and go out and get my nails done, or I'm going to change my hair color and everything like that. It actually goes a lot. It goes a lot deeper than that, and there's a very emotional component to this, right?
Right.
Definitely.
Okay, so how about to Norman and Michelle now? Final question to you guys. To make sure that Guam's system of care when it comes to mental health is kept at an optimum level and everything like that. Many hands make light work, as they so often say. So when it comes to young people possibly considering a career in mental health, and they want to join the ranks and they want to serve our community in this way, what words of wisdom would you pass along to them about what this is meant as your life's work, and why should they consider this kind of work?
Right. For me, I actually came from a different career field for 10 years, and I recently just entered the behavioral health realm, so it was completely new to me. I took that risk only because personally I was dealing with certain things, but I chose to educate myself and find out more about mental health and check in with my mental health. And I strongly encourage the island community, those who are graduating in human services field, to really invest your time in our human services field with Guam Behavioral Health and Wellness Center, because it definitely makes an impact in our community, and it's very self-gratifying in all the things that we do.
Okay, are there any particular demographics in maybe let's get into we got a few more minutes, so if we can get into some of the statistics behind this whole thing, are there any particular demographics in our community which were hit the hardest that you can see over the last year?
That's a hard one. I don't know.
Yeah.
I don't know.
Would anybody that's got a potentially PhD credentials be able to chime in on this?
No, I mean,
Christiane, I'm looking at you.
I mean, just even anecdotally, Jason, like, I don't think there's any, I don't think we saw a real spike in any particular area. I think there were, and I've actually pulled shifts on the hotline a couple times, and there are people who call who are, young people who are just uncertain of where to go next. And then there are people who are calling on behalf of their young child or young adolescent. And then there are people who are calling because they're regular, veterans of the mental health or behavioral health services. So it's like really across the board, there have just been different people who have been accessing services and have been, and Sarah kind of highlighted it earlier that there are people who are maybe more open to receiving mental health services or exploring mental health services, I'd say in the last year than in the past. I've gotten lots of contacts from people I know, acquaintances or even good friends, for referrals to different services. So yeah, I don't think I can say, at least not at this point. Maybe in a year we can look at the data and truly look, analyze that. But at this point, I think that it's kind of across the board. People have been impacted and are looking for assistance.
Oh, maybe that is the most poignant statistic right there. Is like it basically the pandemic affected everybody.
Yeah.
And yeah. Okay, so well, I'd like to give you guys an opportunity, since you mentioned Dr. Whitman, the whole the suicide hotline and the helpline. Can you guys? The work continues. It's still available for anybody on our island who may need it. So go ahead and plug the number and just let people know what they can expect, or even for people that may want to get involved.
Yeah, so I'll let kind of Michelle take this over, but because I think one of the greatest, hallmarks of again, last year has that we've been able to transition to the National Suicide Prevention Lifeline, and we've been able to hire someone full-time to run the hotline, who's Michonne, which is great, and not only adds to the amount of training and quality of services on the hotline. So there's 2 ways of accessing the hotline. I'll let Michonne share that. But also before we end, I did want to share the Goodwill National or Goodwill Ambassador thing. So I'll let her talk about the hotline first, and then I'll share just a little bit about that
All right.
Goodwill Ambassador Award.
Well, I'll start off first, and then we'll have Ms. Sean chime in with a little bit of the hotline. But because this pandemic has really forced us to go into a state of 24-hour crisis services and access to care, and through our federal counterparts, which is SAMHSA, they have given us some funding, COVID emergency funding, which is called Project Again. And Again means Call in Chamorro, which is a 2-year federally funded program by SAMHSA. And we aim to be a certified community behavioral clinic. And under the service requirements, JBOOK aims to establish reliable 24 emergency crisis services for individuals experiencing a mental or substance abuse crisis. We also serve children ages 5 and older with serious emotional disturbances, and individuals 18 and older with serious mental illnesses, including those with substance abuse disorders or co-occurring disorders. Some of the crisis services, which is to include 24-hour crisis hotline, 24-hour crisis intake unit, and a 24-hour mobile response and stabilization services. So through this funding, we were able to enhance our crisis services. And with that being said, I'll turn it over to Michonne to discuss a little bit of what our hotline has to offer and the increase of calls.
Yeah, so if anybody at all needs somebody to talk to, or, they just feel like they need to get something off of their chest, or, just any advice at all really regarding mental health, we are here to help. We average about 600 calls a month. So honestly, it's a very needed service, and there are plenty of people out there that call. So you're not alone. Like it's something that everybody would do.
All right. Well, thank you so much, everybody, for what you do for our island and what you do for our people. We recognize it, we appreciate it, and we thank you guys.
You better recognize. Say it like that, Jay. Right on.
Please, and if anyone in our community is experiencing any crisis or needs someone to talk to, please give us a call. We're 24-hour service. Our crisis hotline at 647-8833.
Right, and no issue is too small or too big, Doc.
Yeah, yep, nothing's too small. I just wanted to highlight really quickly before we get off. So we are actually holding a Goodwill Ambassador Award.
Oh,
and the
no
community
way.
Can actually, yeah.
Oh, that's
the
cool.
community can actually nominate a business, an NGO, or even a government agency. And we're looking for organizations that have assisted the community in accessing mental health services or incorporating mental wellness into their practices. So these are, again, organizations, nonprofits, or government agencies even, who have really assisted and served as ambassadors regarding mental health. They'll be, our nominations close on May 21st, and they can be sent to communications@jibwick.guam.gov. So communications@jibwick.guam.gov, and anyone in the community can nominate an organization that they believe has really integrated mental health into its story over the last year.
So,
and then we'll be honoring or recognizing the award winners and I guess the nominees at our Wellness Festival next Saturday, which is the 28th, I believe, of May. We're having a Wellness Fest at the Oka Park and Play. I hope I said that right. I mean, I hope that that's right. But yes, so if anyone in the community is interested in nominating someone, they can send their nominations to communications@jibwick.guam.gov.
so let's say there was like a multimedia morning show that just always had Jibwick's back and always like got the word out and amplified their message. I mean, totally random if there was.
What if something like that existed? That would be
What
really
if?
valuable.
That'd be a
Yeah,
great
what if?
nomination.
Yeah.
One day. Well, it's
one
something
of the
we.
viewers are going to have to do the nomination, right? So it's communications@gbwc.gov to get that information to make the nomination.
I mean, that's only if you agree with us, our esteemed viewers, who are so great. Thank you.
And sorry, Chris, if I may,
Yes.
I actually wanted to clarify. I'm not sure if I made it clear, but with respect to the mobile response stabilization services, I hope I didn't make it sound like we're already implementing that service. I just wanted to clarify that we are in the planning phases and we hope to launch within the next 2 to 3 months.
Okay. There you go.
Okay. Thank you so much again.
Got
Thank
it.
you.
Got it. We'll see you, Doc. See you, Sarah.
Thank you, you guys. Have a good day.
We'll see you next
Bye.
Tuesday.
Take care.
Okay.
Bye, guys.
That's adios.
Bye bye.
Good interview, Jay. Jason Solis, ladies and gentlemen. I mean, just going in on the difficult issues a lot of times, Jay, and really putting them in a way we can all understand. Appreciate you, my friend.
Yeah, thank you.
Got it.
Will you be nominating me for the?
I will. I might. Yeah. How long you got to write though?
Yeah, you might need to check your email while you're
I just
writing
put your
them, too.
name in there. Is there a box I just drop his name in?
Yeah, thanks.